150,000 open-heart operations performed in this country every year. Did you know that? Probably you did. There are good documentaries about it on television all the time. We all know something about single and double bypass surgeries and how many lives have been saved. That's good. But the kind of surgery most frequently done in America is abortion. That's not meant to save lives. In this country, we perform and submit to 1.5 million abortions every year. That's 10 times the number of open-heart surgeries. Now, the average abortion only takes 5 or 6 minutes, but they've never shown the complete operation on any television channel, anytime. That's not good. That's a big part of what television's for, to explore public questions we care about. Abortion is surely that. The feelings generated, the passionate debates and the issues, safety, morality, long-term consequences, all these intrude on the public conscience much more strongly than any surgery ever has. Political candidates are not expected to take a stand on coronary bypass. The Supreme Court has yet to rule on the constitutionality of heart transplants. People don't take to the streets in thousands to demonstrate their opinions on artificial hearts. Yet the press and television tell us a lot more about heart surgery than they ever have about abortion. I think the media have failed here, badly, in what they claim is their responsibility to inform the public, who will make the final decisions on abortion. If you're looking at me on television now, then they've accepted that responsibility, to inform. The film you're about to see is graphic. Some of you may find it too graphic. There's blood and death. We all remember the horror of the film from the death camps in Europe, the grisly images of the broken victims of Hiroshima. I was in Ethiopia myself. You'll recall the gut-wrenching pictures of starving babies we sent back from there. Well, the babies in this film are not starving, but with those other terrible images, they serve the right of the people to know the victim. When he accepted the Nobel Prize, Elie Wiesel said, "I swore never to be silent whenever and wherever human beings endure suffering and humiliation. We must always take sides. Neutrality helps the oppressor, never the victim. Silence encourages the tormentor, never the tormented." No one's ever spoken more eloquently than that on behalf of the victim. Since 1973, abortion has claimed more than 20 million mute and innocent victims. This film speaks for them. The silence has to stop.
The unborn child at 4.5 months, as seen through the fetoscope, a fiber optic instrument inserted into the mother's pregnant uterus for the purpose of observing the child. This child now weighs 3/4 pounds. It is approximately 1 foot in length. Its hands and feet are at least 1 inch long. During the course of the next 8 minutes, you will witness the ultimate act of violence. This child will be destroyed before your eyes. My name is Dr. Bernard Nathanson. I was co-founder of the National Abortion Rights Action League, and for a period of 2 years, I was the director of the largest abortion clinic in the world. I bear ultimate responsibility for over 75,000 abortions. But over the past 10 years, I've changed my mind on the acceptability of abortion, owing to the immense technological advances which have been made in the field of obstetrics and fetology. Advances such as ultrasound imaging, fetal heart monitoring, and fetoscopy, which have allowed us now to perceive, without question, the unmistakable humanity of the unborn child. We will concern ourselves here with abortion in the 2nd and 3rd trimester. Now, pregnancy is divided into 3 trimesters. The first trimester being the first 3 months of the pregnancy, the second 3 months, and the third trimester from the 7th month to the end of the 9th month. Collectively, abortions done in the 2nd and 3rd trimesters are known as late abortions. The Roe v. Wade 1973 U.S. Supreme Court decision, which legalized abortion, indicated that in the first 6 months, abortion could be done for no reason whatever, and stipulated that in the 3rd trimester, from the 7th month to the 9th month, abortion could be done in the interests of the mother's health, whatever that word means. Listen to Dr. Beverly McMillan, who opened the first abortion clinic in the state of Mississippi. She was soon doing 50 to 60 abortions per week and was the director of that clinic for 2.5 years.
Most people are woefully ignorant about what is even legal in the United States about abortion. They don't know that it's legal through the entire 9 months. Most people think it's legal in the first 3 months only.
Well, in my understanding, the latest time that a woman can have an abortion during pregnancy is 3 months.
The age limit to stop abortion would be 4 months for a fetus.
Legal, 6 months.
I'd guess, I don't know, about 3 or 4 months, something like that, yeah.
I think that it's legal to perform abortions up to between 4 and 5 months.
Here is Miss Joy Height, formerly a medical assistant in an abortion clinic in New Jersey. She participated in innumerable abortions in that facility.
Until I came face to face with abortions, I really didn't know what it was about. When I say that, I mean I really didn't know what I was getting into. And I think that with abortion, a lot of us don't know what it's about, and we don't know what's going on.
Let's look at some data. In the United States annually, there are 1.5 million abortions done, 8% of which are late abortions, abortions in the 2nd and 3rd trimester of the pregnancy. In Canada, there are 65,000 abortions annually, of which 11%, or 7,000, are late abortions. In the UK, there are 170,000 abortions a year, 30,000 of which are late abortions. In the United States, there are 120,000 late abortions annually, 400 every day.
I'd be pretty shocked that they would take it that far late into the pregnancy.
No, not 9 months, it's too long. It's a person by then, definitely.
Well, that's appalling. I mean, it's absurd. The 9th month, I mean, children are born at 8 months, right? There's a lot of kids that are born at 8 months, and they've had kids born sooner than that still be alive and live. 7 or 8 months? I don't know. I mean, it seems like incredible. A baby can be born at 7 or 8 months. I don't know. Doesn't make sense to me.
The procedure, late abortion, has become so frequent that there are actually textbooks written about it, detailing the techniques, and in addition, there are articles written on the subject. Here is an article which indicates that the author studied at least 700 women who had had 3rd trimester abortions, abortions between the 7th and the 9th month, and states the following: dilatation and evacuation, a procedure which we will discuss in just a moment, has been proposed as the treatment of choice for women seeking abortion in the 3rd trimester of pregnancy. D&E, dilatation and evacuation, is the procedure used to accomplish late abortion, abortion in the 2nd and 3rd trimester of the pregnancy. In this procedure, a laminarium, this device, is placed into the cervix, the neck of the womb, the night before. This is simply a piece of seaweed which swells up during the night, and in swelling up, opens up the neck of the womb so that the next morning, when the woman is brought to the operating room and put under general anesthesia, the neck of the womb, the cervix, is already partially dilated. And the cervix is further dilated with instruments of this sort. This instrument is placed up into the cervix. The neck of the womb is further dilated, and even instruments like this are used to accomplish dilatation sufficient to allow breaking of the bag of water, and then the introduction of this grasping instrument, an instrument which can locate the child in the uterus and crush and destroy it.
The patient is being prepared for the procedure. The fetoscope, the fiber optic instrument through which we will observe this abortion as it begins in a swirl of blood. The forearm. Note the blood vessels running under the delicate skin. The hand and the fingers. This thick blue coiled structure is the umbilical cord. This is the child's lifeline to the mother. This was a little boy. The ear is readily identifiable. It has been shown that in the later months of pregnancy, the child will react to sound. The nose. Here is the mouth. This little fellow can be seen swallowing water. The eyebrows. The eyelids are still closed. These are the tools of the abortionist's trade. In a few moments, this little boy's life will be summarily extinguished with these instruments. The cervix has been sufficiently dilated, and the bag of water is broken. The umbilical cord has been severed, the lifeline cut and collapsed. Now it is being wrenched free of the child's body. And now the abortionist is reaching into the uterus with the grasping instrument to dismember the child.
Piece by piece, the extremities are pulled away, then portions of the back, the spine, and the torso.
A portion of the chest and abdominal wall has been torn from the body. The ribs are easily identified. Can anyone doubt this child has experienced an unimaginable agony? Pieces of the torso are being removed, and the parts are stacked on the table to the side of the abortionist in preparation for reassembling the child to assure that the abortion has been complete. In this pathetic pile of human rubble, we can discern a leg with the foot still attached.
The head is located, and having been located, is grasped in the jaws of the clamp. The clamp crushes the head, and the head is then removed in pieces.
The crushed head has now been removed, and the white matter of the brain has spilled out.
After the procedure has been completed, this instrument, a curette, is introduced into the uterus. This curette is used to scrape out all the fragments and the shards of the afterbirth and the child which remain, and the procedure is then at an end.
Now listen to the testimony of Dr. J. Kellenson, who performed the abortion in the film The Silent Scream.
How many abortions would you think you've performed in your career?
I'd say I probably performed 10,000 or more. I can remember days when I would do 30, 35 abortions.
Would you do second trimester late abortions, D&Es, even for medical reasons?
No, I absolutely not. I mean, that is probably the most horrifying procedure I can think about. There's just absolutely no way that I would ever do that.
Here is Dr. Joseph Randall, former director of an abortion clinic in Atlanta. His clinic was doing 50 to 60 abortions a day.
It made me realize for the first time in that that I was doing not the right thing, that I was killing babies and not serving women. Everything kind of, I just got fed up, and I was hurting so much, I was feeling bad inside, I was nearly, at times, suicidal. I would be more willing to give my own life than to perform an abortion.
Dr. Arnold Halpern was a director of a Planned Parenthood abortion clinic.
The other thing that gave me license to do abortions was the fact that I never personally considered a fetus a real baby until 20 weeks of gestation, when one could hear the fetal heart tones and the woman feel movements. Now, somewhere along the line, I was apprised, or thought I was apprised, that the fetus was not a human being until it arrived to the point where a woman could feel that baby move. As we've gone from 1982 to 1986 and into the late 1980s, we realized that the fetus really is a child, and that it really is moving, and the heartbeat is really beating by the use of ultrasound and modern techniques of detecting the fetus.
There is no difference between a first trimester abortion and a second trimester abortion, or a third trimester abortion, or infanticide. It's all the same human being in different stages of development.
And one day I walked into the abortion clinic with 10 or 12 or 13 women waiting, and I realized that I could not do any more abortions. I felt uncomfortable doing it. I felt disgust at myself. I realized now that I had been starting to do second trimester abortions, and not only did I see a little bit of tissue coming out, I saw fetal parts, and I saw babies coming out, and I felt that I was so uncomfortable at this point that I could not continue, and I walked out of the clinic and left that clinic without doing the abortions and never entered the abortion clinic again.
I finally got to the point where I could not look at those little bodies anymore. There's no doubt in my mind that I would never perform an abortion ever again. We have gone into a noble profession for healing, and we lose sight of what we were called to do when we get into the killing business.
Medical technology is rapidly and drastically altering our concept of viability, the capacity to be born prematurely and survive. Today, babies born at 6 months have a 65% chance at surviving, and 80% of these babies will be perfectly healthy. Neonatologists are keeping smaller and smaller babies alive. Here is Renee King. She is now 1.5 years old, happy and healthy. She was born at 5 months. The unborn child is not the only victim. Women are victims too. There are approximately 7,500 serious complications a year from abortion. Major hemorrhage, perforation of the uterus, serious infection, hysterectomy. What follows is the testimony of 2 young women who have been irreparably injured by late abortion, one physically and one psychologically. They too are in every sense innocent casualties in this ongoing tragedy of abortion. Because they have suffered so grievously, we have shadowed their faces to preserve their privacy.
If the doctor would have told me that I was 4 months pregnant, I don't think I would have had an abortion. I would have considered that murder at that point. The baby heart was beating. The baby's developed, really. And I would have never had an abortion. The doctor did not tell me anything about a D&E being dangerous. The doctor didn't discuss anything to me about any risks. I wasn't told one word. Nothing about, my uterus being burst through, and all these things happen.
This young woman is a practicing psychologist.
When I was examined, the doctor said that he had been mistaken. The baby was far more advanced than he had thought, and that it was 15 weeks. And I really just was in shock. Within a minute, I was aborted. Waited a few minutes, and I got up to get dressed. And when I went over to the dressing room, I saw a bucket of blood. And my baby was in the bucket of blood. And the baby was not an inch big. The baby was as big as my hand, and it was a real baby. All I could think of was that I had murdered my baby. I started deteriorating emotionally that night. Over the next month, I cried, not normal cries. I cried from the bellows of the earth. I remember just leaning at the top of my staircase, wishing I could throw myself down to the bottom. I remember thinking of jumping on the roof and jumping off. I thought of every method of suicide I tried to consider doing. And I cried so deeply, so constantly and so deeply. It was like the wail of a newborn baby when they cry and their fists are clenched and they just cannot control the crying. And somehow I thought it was the most extraordinary crying that I could see myself doing.
When I looked at my stoma of my colostomy, you know, it really upset me. I couldn't believe it. I hated to be around a lot of people, you know, only my family. I wouldn't like to go around, you know, the people that don't know anything about me. You know, there's a lot of embarrassing sounds from the colostomy. And I always felt like somebody could smell me or, you know, hear, you know, gases coming out.
My husband blames the whole thing on the abortion, and certainly our lives crumbled from the time of the abortion.
Now, to my knowledge, I find out that if I do have another baby, that it could probably kill me. I would have never had an abortion if I knew these horrible things could happen to me, because that's the only way to explain it. It's not worth going through.
I have seen, either through referrals or in my practice, more through referrals since my abortion, people who have had as serious an initial reaction as I had. It seems to me that almost no attention is paid to the psychological disaster that happens to so many people through abortion. Abortion is not something that was developed or invented by the women's movement. I think the women's movement has been terribly deceived about and has misunderstood what abortion is.
Sometimes I could sit back and I could think about what happened, and all I could do was just cry.
Abortion, all abortion, is violence. And violence is an impermissible alternative in a world of reason. Late abortion, the systematic, deliberate destruction of a viable fetus, is especially odious. Regrettably, it bears the unmistakable trademark of the irrational violence that has pervaded the 20th century. There is no rightful place for violence in a world of reason. Those qualities which grace such a world of light and reason are kindness, compassion, patience, and love. This is the face of the world of violence. This is the face of the world of love. What kind of a world do you want?